And joining us now to talk about the Delta strain is an ER doctor, friend of the show, West Michigan. He resides in. He's been in the front lines throughout this pandemic. Dr. Rob Davidson, welcome back to the show. You're also the executive director of the Committee to Protect Health Care. Good morning to you. You know, we've been hearing more and more about this. Good morning. The Delta strain, referred to as COVID on steroids. What makes it so different?
Well, you know, viruses mutate. It just happens. Every time they get into a host, every time they're in a community, they change a little bit. Sometimes those changes are minor and they don't amount to really anything, but every once in a while, one of those changes really takes hold and it makes the virus easier to spread. So the real danger in this is it's more contagious. And I've heard numbers of 50% or 60%. It really doesn't matter exactly how much more contagious. Just know that, you know, when they told you before 15 minutes in a room with someone, maybe now it's down to 10 minutes in a room with someone where you're likely to get it. And so it just tells us why these communities and states, but particularly at the community level that have lower vaccination rates, those are the places that are at the highest risk.
Doc, let's talk more numbers. Despite what you just said, the numbers when it comes to vaccination still aren't very high or reaching the goals that President Biden had hoped for by 4th of July. He wanted at least 70% of Americans to have at least one shot by the 4th of July. Right now, 45%, according to the CDC, fully vaccinated. Not going to reach those goals, may never reach those goals. Do you think, what is it going to take, I should say, for people to finally get it, finally understand that this is something that is needed to decrease what is going on in this country and around the world?
Well, listen, some of this is out of my control and your control and any of our control. There are, you know, corners of the internet that are unfortunately too big, places like Facebook, media channels like Fox News and others, and frankly, elected officials in the Republican Party especially, who are just telling people this isn't a big deal. You know, people have been hearing that for a year and a half, unfortunately. Some of that is going to be really hard to get over, but it's going to happen at the community level. You're going to have doctors in their offices. I do this in the emergency department. I talk to patients every day who haven't been vaccinated, trying to get them to get the vaccine. Unfortunately, I work in an area, you know, that voted for the former president at 70% clip. So a lot of people are telling me, well, I've heard that, you know, I've seen that, people tell me that, and, you know, fill in the blank, but have so many reasons that just don't jive with the truth as to why they don't want to get vaccinated. So we got to work on this at the community level. The big national numbers are important, yeah, but it's really what's going on in your hometown that is critical.
You got millions around the world who have died of COVID, and you would think that people would get the message. But we got to keep at it. What are the risks of not having a larger percentage of the population vaccinated? 150 million, that's great, but still, we need more, right?
Right, we do. And when we have these more contagious strains, it just means that the fewer people vaccinated, the more people are at risk. And again, this isn't going to pop up. I think I heard someone on that package you had. This isn't going to pop up as big national numbers. It's going to pop up in communities and at different times. It's going to be like whack-a-mole again, as we did last year, coming into the fall and the winter. I think July 4th is a big date, right? It's Independence Day. We really want to have those numbers. But really, I'm looking at the fall and the winter as those times where we need a higher percent vaccinated, because as people head indoors, that is when this thing is going to take off, you know, place by place, and we just have to be vigilant.
Yeah, and it might be time for those who have already been vaccinated to actually get a booster shot. We've been talking about that for a number of months as well. Let's talk about the people who are vaccinated, because I have to admit, being vaccinated, you kind of, you know, get a sense of invincibility, like you're over this whole thing, and that might be the wrong thing to do. You're aware, but you're not cautious. So tell us why we may be wrong in that thinking of thinking, okay, we can just go out there and do anything we want to because we have been fully vaccinated.
Well, if you're a person with a strong immune system, you know, and as far as you know, if you don't know otherwise, you should have a strong immune system. You know, if that's you, you maybe shouldn't feel invincible, but you should feel pretty confident that you're not going to catch this or any other strain. We're at over 90%, I believe, with this Delta strain, or right around 90%. That you are completely protected from any kind of symptoms. You might get it, you might get a few symptoms. You're not going to end up in the hospital. You're not going to end up dead. And so I think you can be pretty confident doing most things. Now, for me personally, if I'm going into a tightly packed indoor type of situation and I just don't know the vaccination status of the people around me, I put my mask on, because the reality is, who cares?
Yeah.
If it's for 10 minutes in a store somewhere, it's easy. I keep it in my pocket, I put it on. But in most scenarios, I don't wear it. A quick trip to my store that isn't packed, or certainly around people that I'm confident, many of them are vaccinated. This feels like it did before we ever heard of COVID-19.